A radiological, nuclear disaster involves the release of a radioactive isotope to the environment, lethal or harmful effects to individuals and/or the environment, and then some sort of faulty reactor core. When a radiation incident occurs, it may first be approached as a trauma response, going for life-saving interventions immediately and then later on assessing the lasting environmental damage that may have resulted. Patient contamination is one of the most important factors to assess, and patients in general are dealt with on both short-term and long-term basis, as radiological, nuclear disasters have been proven to have long-lasting adverse health effects other than the systemic irradiation and trauma that may result after immediate exposure. In terms of the response, the key response agencies are under the control of the EPA, and generally include the Department of Defense, Department of Energy, and Nuclear Regulatory Commission. In conjunction with state, federal, and local resources, all of these agencies are responsible for communicating amongst each other into local agencies for medical assistance, emergency medical services, state and local health departments, and public health agencies regarding spread of health and safety related information to the general public. Individuals that may have been exposed to radiation must be assessed before certain medical treatments are given, as they may differ in intensity depending on the type of radiation exposure, and may indicate testing of other individuals in the area, quarantine, and/or other protective environmental measures. The Nuclear Regulatory Commission acts to regulate use of nuclear reactors in general, standards, protocol regarding their operation, and assessments of environmental damage. The Department of Energy also assesses environmental damage, and is responsible for the facilities that house nuclear products, radiation materials. The Department of Defense is necessary in cases of military or terrorist-related nuclear weaponry. Working alongside the FBI, they determine how and why the disaster occurred, including potential alternative motives. The response taken following a radiological, nuclear disaster is initially an environmental one, as the effects that radiation have on the environment may span a vast area and be incredibly detrimental. The emergency support function that a disaster of this nature would fall under is ESF number 10, oil and hazardous materials, including short-term and long-term cleanup. This response also involves ESF number 15, external affairs, if involving terrorist or military intent, ESF number 8, public health and medical services, to assess mass injury/fatality, ESF number 3, public works and engineering, to ensure safety of nuclear reactors in plants such as Chernobyl, ESF number 14, long-term community recovery, depending on the environmental devastation to the surrounding area that may have resulted from the radiological disaster, and ESF number 2, communications, to ensure federal, state, and local agencies are coordinated with one another, and to ensure that the proper care is being given to those affected. EPA has the primary authority in incident scenarios of this topic, and is the creator of the Radiological Emergency Response Team, a team of scientists, radiation experts, and communications experts that work together to support state, local, and federal response efforts during the disaster. This team involves the National Center for Radiation Field Operations, National Analytical Radiation Environmental Laboratory, the Radiation Protection Division, and a breadth of equipment, including a mobile environmental radiation laboratory, a mobile command post, air monitors, field monitoring and sample collection equipment, and aircrafts. There are many different types of ionizing radiation that may affect individuals: charged particles, photons, uncharged particles, photons, or a mixture of both. There are also several different types of ionizing particles. These include alpha and beta. Alpha particles are helium nuclei without electrons, and can only penetrate up to the first skin layer, except when internalized, at which point they are more dangerous. Beta particles are high-energy electrons, and can penetrate slightly further into the skin tissue. There are also rays that can produce ionization, X-rays and gamma rays, which are composed of photons and can pass readily into tissue. Neutron emission is another type of ionizing particle, and has the potential to penetrate the most deeply, and is of high potency. During the Chernobyl disaster in 1986, tests were performed to see if the reactor number 4 could keep cooling pumps operating during a power outage until the backup generator could trigger. The Chernobyl plant had a power surge while the tests were performed. Chemical elements like iodine, cesium, and strontium were among the major elements released through radiation. This disaster involved 30 total deaths resulting from a flawed reactor design that was operated by untrained personnel, which caused a steam explosion and fires that last 10 days. On the day of the disaster, there were 2 deaths, and 28 later on due to acute radiation syndrome. Additionally, 237 individuals were diagnosed with acute radiation syndrome, though most survived. Acute radiation syndrome occurs when the entire body is penetrated by a high dose of radiation in a short period of time, and can cause symptoms such as severe skin damage, loss of appetite, nausea, fever, vomiting, diarrhea, seizures, and possible comas. Because of the potential for medical traumas such as these, immediate medical attention following a radiological, nuclear disaster is essential. All of these effects occur due to severely damaged cellular mechanisms and DNA, which can either be high or low risk. When patients are assessed in hospitals and/or other types of medical treatment facilities, they are given tests for radiation exposure to confirm the nature of the disaster, all according to radiation incident protocol. The incident command structure of this event should follow the response plan created by the EPA. First, after the explosion, individuals were evacuated and assessed for radiation poisoning. Those testing positive were hospitalized and sent for treatment. Meanwhile, firefighters assessed the damage on site, along with individuals from the Radiological Emergency Response Team, who checked the situation of continuous radiation release and exposure on the site, and its effects in the environment. Then a state commission was created to look into the cause of the explosion and plan to mitigate its consequences. Because of the issues in the Soviet Union at the time, there were issues with agencies taking responsibility for the faulty reactor and faulty reactor operation. Therefore, members of the State Commission had to push to demand evacuation of all personnel and admittance of faulty reactor use responsibility. Iodine tablets were then distributed to counteract the effects of radioactive iodine, one of the most potent elements released in this explosion. When the evacuation was finally approved and followed, police officers and representatives helped evacuees onto buses away from the site until the radiation levels were lowered. Radiation was continually monitored in the area following cleaning the plant to remove surface level chemicals. Ideally, the response structure involves a lot more interagency cooperation and following of protocol. The Chernobyl disaster overall marked a fairly large learning experience for radiological, nuclear disaster response agencies for future incidents. Although the disaster at the Chernobyl nuclear power plant in Ukraine occurred as a result of faulty equipment and inadequately trained employees, the circumstances of the Cold War and lack of standards for safety protocol are the true reasons that a disaster of this nature occurred. Therefore, federal, state, and local regulations are essential to the operations of industries such as these, and in the prevention of unnecessary mistakes in the future. Lessons learned from this response could include having a response plan in place before an incident and avoiding procrastination on major decisions, in addition to having stricter protocol in place for employee training on hazardous job sites. Many nations learned what worked and didn't work following this disaster. In the case of this disaster, the response plan had very few strengths. The Soviet Union did not have a strong response plan. Regulations were adopted in the Soviet Union in 1963, saying that evacuation of the civilian population was not necessary unless the radiation dose was high. After the explosion from Chernobyl, high doses of radiation were produced and the State Commission did not follow the regulation plans until 1.5 days after the incident, which could be the potential reason for the high number of deaths related to acute radiation syndrome and other effects of radiation poisoning in the weeks, months following the reactor explosion. The lessons learned from this disaster include generating more effective communication measures among agencies, and including more safety protocol measures in areas of work that may be hazardous to the employees and surrounding environment. Protocol plans should be operationalized around national interests and conflicts, prioritizing civilian health over strained relations of any sort. Additionally, because radiological, nuclear disaster may occur as a result of terrorism, comprehensive response plans must be designed on national and regional levels in order to respond adequately to a nuclear event, which may have an incredibly wide span of impact. These response plans must account for the many different types of nuclear devices. Radionuclide dispersal devices, dirty bombs, can contaminate large amounts of land but do not involve a nuclear reaction. Improvised nuclear devices are most commonly constructed by terrorist groups, tactical nuclear weapons are most common in military groups, and strategical nuclear weapons are common in military groups as well, but are often more efficient and generate less casualty. In a response coalition, local and national officials are responsible for generating a response plan, in this case, the Environmental Protection Agency. First responders and military, defense officials assist with evacuation and emergency operations. These individuals will transport those in need to medical facilities, and assess the nature, intent of the disaster. volunteers may also assist in evacuation efforts, and later on, along with public health officials, movements of decontamination.